twitching of the heart muscle, and sometimes you even come like you even feel it through your arteries. Now, this infective functioning results in an insufficient supply of blood being carried to the body's tissues. So when you feel that, you know that there's an insufficient blood supply is being carried to the body's tissues. And this one is very popular as well, cardiac arrest. Now, cardiac arrest occurs when the heart stops beating. When this happens, the blood supply to the brain is cut off and the person loses consciousness.
Right.
A person in apparent good health who experiences cardiac arrest usually has unsuspected coronary artery disease.
I know somebody who had this happen to them. The good thing is that the person was exercising all the time, and what we were told by the doctor is that the muscles were so strong that it was able to help the person. It's actually my brother this thing happened to when he heard that the mother died, and so they had a cardiac arrest, but he was able to come out. The good thing is that it was just a few seconds because it cannot be any longer.
Yes.
All right, and so he came back out and he's okay now. Seemingly okay. And I watch him every day, call him all the time to make sure that he's okay.
Yes.
All right, yes.
All right, so the other one is cardiomegaly.
Right.
Now, the medical term for enlargement of the heart. This is when you say the heart is enlarged.
Right.
Now, if the heart is unable to function effectively, as in heart failure, or if there is too much resistance to the normal pumping of blood through the blood vessels, as in high blood pressure, the body attempts to increase the strength of the heart by increasing its size. Cardiomegaly is characteristic of a number of different heart disorders. Now, it is also known as cardiac hypertrophy. Right. So another term is cardiomyopathy. Cardiomyopathy. Now, any of a group of diseases of the heart muscle that results in impaired heart function and ultimately heart failure. This is what it describes the cardiomyopathy.
Yes.
Now,
Cardioversion. Oh.
cardiomyopathies are classified according to the characteristic physical changes of the heart,
Yes.
such as enlargement of the heart, dilation of one or more of the heart's chambers, or rigidity of the heart muscle. These disorders may be related to inherited defects or may be caused by any of a number of different diseases. Often the cause is unknown.
Right.
So you have to do that diagnosis.
Right. When you remember we were talking about the arches and when the arches become hardened, when things are clogged to the side. All right. You know that your heart have to be pumping the blood to go through it. When it is clogged up, then the pumping becomes difficult because it is not moving through as freely as it should. Your heart muscles can actually become more than what it should be, because which means it is exercising very hard. It is going very hard, which means that the walls of the heart muscles are going to be thickened, and this is the cardiomyopathy that happens there. This is what it was being described there. Because the walls of the heart becomes thicker than usual, because of the amount of work that it has to do. Once you work something very often, then it becomes muscular.
Yes.
And once it becomes muscular, then it becomes difficult to do the regular work that it normally
Your
does.
heart is a very
Yeah.
important
Yeah.
organ in your
Mhm.
body. And if there is anything outside of the normal function, it is a heart failure that you're having because your heart is not functioning in the way that it should. And sadly, we do these things to ourselves. You know, we eat the things that we're not supposed to eat. We
Mhm.
clog our arteries. We do not exercise, and we do not, you know, practice proper dietary functions. We do not exercise. We do not do the things that we are supposed to do. And this is one of the reasons we get sick, and this is one of the reasons our heart does not work the way it should. Some persons may not have a heart failure even though they consume these things and they because they are very active.
Right.
But there are some persons who are not active. And there are some persons who do not even eat the things, as you were saying earlier, that help to flush your system. So this is this build up over time causes to be your heart to move sluggish, the movement of your blood is thick and sluggish. It doesn't go to the areas that it's supposed to go freely. And these are the things that cause our heart to, you know, experience these problems. Another condition that we are going to look at is cardioversion. Now, this is a procedure used to correct arrhythmia,
Mhm.
in
I remember what
which,
arrhythmia is. The
yes,
rhythm in
the
which it
disruption
is
in the
out of the
normal
rhythm. Right.
rhythm of your heart.
Right.
Right. So, in this procedure, in which electrical current is applied to the heart to restore normal rhythm. Right. So this is called a cardioversion. Now, carditis, or yeah, carditis. Now, carditis, inflammation of the heart muscle. This can result from infection or from an inflammatory response, as in rheumatic fever, and it can lead to permanent heart damage if not treated. All right, and this is carditis. Now, carotid artery,
Yeah, the carotid artery.
the
Yeah.
carotid artery,
Yeah.
carotid artery. Now, this is the major artery to the brain. And when persons go into when this artery is damaged, then you they call it, they say you come brain dead, you become
Right.
brain dead.
The carotid artery, the location of this
Ouch.
artery is important.
Hmm.
We call it the jugular vein. This is the one we call the jugular vein.
Hmm.
It is normally right at your neck.
Neck.
And the one that people who are butchers will know about it. Because once they cut it, the animal dies. Because the blood to the brain is not going anymore. And so you cut it. The carotid artery is important to keep it firm and to make sure that you do nothing to hinder the flow of blood to your brain. Flow of blood to your brain is very important. All right, so I kind of know this one from a job that I was doing. I
Yes.
used to do. All right.
Yes.
Yes.
So another procedure is the catheterization.
Yes.
This is a procedure sometimes used to diagnose the condition of the heart and or the circulatory system, and in some cases to treat cardiovascular disease.
Right.
So a hollow flexible tube called a catheter is
The catheter.
inserted
Yes.
to
Mm-hmm.
catheter
Mm-hmm.
is inserted by means of a very fine flexible wire
Yeah.
into the blood vessels somewhere in the
Mm-hmm.
body,
Yes.
usually in the arm, the
Mm-hmm.
neck, or the leg.
Mm-hmm.
And from here, it is threaded through the blood vessel
Mhm.
to the heart
Right.
or other location being investigated.
Right.
Now, the catheterization
Mhm.
can be used to detect and in some cases to treat arterial blockage,
Yes.
to discover malformations of the heart,
Mhm.
and to study the electrical conduction in the heart,
Mhm.
among other things.
Yes, this
So
is
this
a
is a
delicate procedure that is used
right.
by doctors
Mhm.
to determine, most of the time, if there is a blockage somewhere and to
Mhm.
clear it.
Yeah.
This is very important to know that this is done. You should not try this at home because it
No,
has
not
to.
at all.
Yes,
You
this has to
not at
be
all.
this has to be done with a camera for the fluid for you to
It
understand.
has to be done by a professional.
Professional, and you have to know exactly where this wire is at all times, so that you can direct it.
Yes.
Yes.
Another one is the claudication.
Mhm.
Now, cramp-like pains in the legs as a result of poor circulation to the leg muscle. Now, this usually occurs as a result of arteriosclerosis, right? Congenital heart dis- a heart defect that is present at birth or not necessarily inherited.
Mhm.
And you have another one, a congestive heart failure.
Mhm.
Now, this is a condition of chronic heart failure that is